Hello friends, welcome to a new lecture today. In this lecture, I would like to discuss about the bony outlet or anatomical outlet of pelvis. So let us learn about the bony outlet or anatomical outlet of the pelvis. So this bony outlet or anatomical outlet, it is mainly lined by, I will draw it again, just a minute. So this is the diagram which I thought of drawing. So if you see anteriorly, it is bound this bony pelvic outlet. So if you see, this is the pelvic outlet, right? So if you see, this is the pelvic outlet. So the bony pelvic outlet, sorry, this is the pelvic outlet. It is bounded anteriorly by pubic symphysis, and posteriorly by tip of the coccyx, and laterally it is bound by ischio. So for laterally, you can see this diagram. So if you see in this diagram, anteriorly pubic symphysis, posteriorly coccyx, and if you see laterally, it is bound by ischiopubic rami first. This is ischium pubis, so ischiopubic rami, ischial tuberosity, and sacrotuberous ligament. Sacrotuberous ligament. Okay, this will constitute of two triangular planes which are bound by. So from here you will have ischial tuberosities. I didn't draw ischial tuberosities in this diagram. So this is the ischial spine. Okay, ischial tuberosity, I'm sorry, these are the ischial tuberosities and ischial spines. So this is the ischial tuberosity. So the two lines which join, make a line joining these two ischial tuberosities. This is one, this is two. Okay, so once you make a line joining the ischial tuberosity, then you will see the formation of two triangles. First triangle, though the second one is not exactly a triangle. So you will see formation of two triangular planes, okay, which are joined by a common base. Okay, the apex of the anterior triangle is formed inferior to the pubic arch, and that of the posterior triangle is at the tip of the coccyx. So I won't draw here. I'll show you in my next previous picture. So just a minute. Yeah, if you draw, oh, you can't draw here. Okay, this is here. So as I have already seen, I have already shown, now this is divided into two triangles. Now what is the shape of this pelvic outlet? So the shape of this pelvic outlet, if you see, it is like this, right? So it is around a diamond shaped. Shape is diamond shaped. And what is the plane of this pelvic outlet? Plane is formed by the lower border of pubic symphysis to the tip of the coccyx. So I'll draw plane here, or else I'll draw one more picture, just a minute. Now for the plane of the pelvic outlet, if I draw a line, so the plane of the pelvic outlet, it is the line joining the lower border of pubic symphysis to the tip of the coccyx. So this is the plane. Okay, so how does this plane formed? It is formed by joining lower border of pubic symphysis to coccyx. Okay, so this is the plane of the pelvic outlet. Now what about the axis of this pelvic outlet? I'll even write axis in this picture itself. Now axis of pelvic outlet, it is a mid perpendicular line drawn to the pelvic outlet, a plane of the pelvic outlet. So this is the plane, it is a mid perpendicular line drawn to the plane of the pelvic outlet. This is the mid perpendicular line. So this is called as axis of the pelvic outlet. So what is it? It is the mid perpendicular line drawn to the plane. Okay, what is the direction of it? It is downwards and forwards, right? Downwards and forwards. So this is the axis. Now what are the diameters? So let us now learn about the diameters of this pelvic outlet, anatomical outlet. Just a minute. So let us learn about the diameters now. So for the diameters, if you see, first I would like to discuss about the anteroposterior diameter. So what is the anteroposterior diameter of bony outlet? So this bony outlet anteroposterior diameter is the lower border of the pubic symphysis to the tip of the coccyx. Now if you see the previous lecture of bony outlet, the anteroposterior diameter is from the pubic symphysis to the tip of the coccyx, tip of the sacrum. Just a minute, I'll just draw a diagram again. Okay, so this sorry. So this will show anteroposterior diameter. Okay, so this is anteroposterior diameter. Okay, so this is around 13 centimeters. Okay, it is from pubic symphysis to tip of coccyx. Okay, so this is the bony outlet. So this diameter is 13 centimeters with the coccyx pushed back by the head when passing through the introitus in the second stage of the labor. When the coccyx is in, so this 13 centimeter is when coccyx is pushed back. Only when coccyx is pushed back, then it is 13 centimeters, or else it will be 2.5 centimeters less, or else normally in us it will be 13 minus 2.5 centimeters, that is equal to 11.5 centimeters. Okay, sorry, 10.5 centimeters. Yeah. Okay, so this is about anteroposterior diameter. Now I have said that I have said two entities, one the bony pelvis and the other the bony outlet and the other obstetric outlet. So I will draw the differences between them here just in the anteroposterior diameter so that it becomes easier. Okay, just a minute. Yeah, so if you see the outlet, the bony, so not the bony outlet, first we'll see obstetric outlet. Okay, the anteroposterior diameter of obstetric outlet, if you see the anteroposterior diameter of obstetric outlet, it starts from the lower border of the sacrum to the pubic symphysis, lower border of pubic symphysis. So this is the, what is this called? Anteroposterior diameter of obstetric outlet. Anteroposterior diameter of obstetric outlet is this one, between the pubic symphysis and tip of the sacrum. Next, the diameter which we have discussed just now, anteroposterior diameter of bony pelvis, this is from the lower border of pubic symphysis to the tip of the coccyx. Okay, so this is anteroposterior diameter of bony outlet. Okay, the main difference between these both is here tip of the coccyx, whereas here it is tip of sacrum. Okay, that is the only difference. Okay, now this is about anteroposterior diameter. Now let us learn about the transverse diameter in the next page. Just a minute. So now let us learn about the transverse diameter. So first, coming to the transverse diameter. So first I will explain about the transverse diameter of this normal anatomical outlet, and then I will explain about the transverse diameter of obstetric outlet again, so that it becomes easier. So transverse diameter, it starts from the two tuberous ischial tuberosities. So this is the transverse diameter. Okay, this is transverse diameter. Let me just write it. It is between two ischial tuberosities. What is the dimensions of this transverse diameter? It is also called as intertuberous diameter, that is between the two ischial tuberosities. It is around 11 centimeters. Okay, now let me just now differentiate between the transverse diameter of pelvic, that is bony pelvic outlet, and obstetric pelvic outlet. So as I have just said, the bony pelvic outlet, the transverse diameter is between the two ischial tuberosities, that is called as interischial diameter. This is transverse diameter of bony outlet. Okay, which is also called as intertuberous diameter. How much is it? 11 centimeters. Then there is one more thing which is called as transverse diameter of obstetric pelvic outlet. So the transverse diameter of obstetric pelvic outlet is between the two ischial spines. So this is transverse diameter of obstetric outlet. Okay, so this is also called as interspinous diameter. It is around 10.5 to 11 centimeters. So I will write it as 10.5 centimeters or 11 centimeters. Okay, so there is very little distance between these both, so this will be 10.5 centimeters. So this is about the transverse diameter. Now there is one more diameter which is called as posterior sagittal diameter. Just a minute, I'll draw diagrams again. Now here first, now we will learn about posterior sagittal diameter, right? Posterior sagittal diameter. Okay, first I will explain about the posterior sagittal diameter of pelvic bony pelvic outlet. So this posterior sagittal diameter is the distance between the, so first you will have to join the midpoint of transverse diameter of outlet. So what is the transverse diameter? It is intertuberous diameter, right? This is the transverse diameter, which is intertuberous diameter. So this is intertuberous diameter or transverse diameter. Now for the posterior sagittal diameter, it is the distance between the sacrococcygeal joint. It is somewhere here. The distance between the sacrococcygeal joint to the midpoint of this intertuberous diameter. This is called as posterior sagittal diameter. Okay, this is between, it is around 8.5 centimeters. It is clinically measured by the distance between the sacrococcygeal joint and the anterior margin of the anus. but anyways it is the distance between the sacrococcygeal joint to the midpoint of transverse diameter. Okay, now let me show you the posterior sagittal diameter of the obstetric outlet and the pelvic outlet in one diagram. So if you see, this is the transverse diameter of the normal bony outlet. So this is the posterior sagittal diameter of bony outlet. Okay, this is posterior sagittal diameter of, I'll write with smaller one. Okay, posterior sagittal diameter of bony outlet. How much is it? It is around 8.5 centimeters. Now, what about the posterior sagittal diameter of obstetric outlet? Okay, one more thing which is difference here is, so this posterior sagittal diameter of bony outlet, it is from sacrococcygeal joint. So I'll draw one more picture which is in lateral view so that you will understand. Okay. So before that I'll draw the posterior sagittal diameter of obstetric outlet. So for the obstetric outlet, this is the interischial spines and this is the posterior sagittal diameter of obstetric outlet. The distance is around 5 centimeters. Okay, I'll draw in one more axis so that it becomes easier for you to understand the difference. So this is the sacrum, this is the pubis. Okay, this is the coccyx. Okay, this is the sacrococcygeal joint. Now think that there is spines are here. These are the spines, because if you see, it is something like this. Okay, and the tuberosities are somewhere here. Okay, around, this is just an arbitrary because it's difficult to analyze in this way, but I really have drawn this so because to see the differences in the attachment, posterior attachment of this posterior sagittal diameter. So first we will draw about the bony outlet, that is green color. Okay, so now if you see the bony outlet, so in the bony outlet, the posterior sagittal diameter, that will start from the sacrococcygeal joint. So this is sacrum, this is coccyx. Sacrococcygeal joint to the so this is the tuberosity. So the midpoint will be somewhere here, right? Midpoint of transverse diameter. So this is like this. Okay, somewhere something like this. Okay, it is the midpoint. Think that this is the midpoint. Then this is from the posterior part of sacrococcygeal ligament. It's a sacrococcygeal joint. If you see the obstetric conjugate, that is from the tip of the sacrum to the interspinous diameter. Okay, tip of the sacrum to interspinous diameter. So so by this we can understand one thing, that the attachments for posterior sagittal diameter of obstetric, sorry, this is bony, of bony outlet is from sacrococcygeal joint whereas posterior sagittal diameter of obstetric outlet it is from tip of the coccyx. So this is the major differences between the two. So this is about the posterior sagittal diameter. So I think you guys have understood about the posterior sagittal diameter of both obstetric outlet and also pelvic outlet. So thank you guys for watching my lecture. In my next class I will explain about the no, I'll complete it off. It's just two more sentences are left. I forgot. Yeah. So just a minute. I'll draw a diagram. Now some more important things about the sorry, bony outlet. One angle, there is an angle which is called as subpubic angle. So this is the subpubic angle. This is the, just a minute, I'll increase it. Yeah, this is the subpubic angle. So this is called as subpubic angle. So what is it formed by? It is formed by the approximation of two descending pubic rami. What is the diameter of the subpubic angle? It is around 85 degrees. Okay, this is subpubic angle. Then there is called as pubic arch. So if you see what is called as pubic arch, just a minute, I'll just draw the similar diagram again. Now what is meant by pubic arch? If you see, pubic arch is the arch which is formed by the descending rami of both the sides. So if you see, these are the descending rami of both the sides. This is going to form an arch. This arch is called as pubic arch. So this is pubic arch. So what is pubic arch? If you see, pubic arch is an arch formed by descending rami of both the sides. Normally if you see this pubic arch, this measures 6 centimeters. Between it forms 6 centimeters between the rami at the level of 2 centimeters below the apex of subpubic arch. Just below the apex of the subpubic arch, this forms 6 centimeters. Okay, how are you going to assess it? It is mainly assessed by placing 3 fingers side by side. By placing 3 fingers side by side, we will assess it. Narrower the pubic arch, more is the fetal head displaced backward, and hence less is the room available for it. Okay, so in this, one of the most important thing which is important here is waist space of Morris. Okay, there is one more thing which is called as waist space of Morris. So what is this waist space of Morris? It is the available anteroposterior diameter. Normally the pubic arch is rounded and the less space is wasted under the pubic symphysis. So what does this waist space of Morris? It represents that, for example, if this is the baby, okay, so this is the baby, so the baby is like this. So this space which is present between the baby and the pubic arch, okay, the space between the baby and the pubic arch, this is called as waist space of Morris. If you see, This is called as waist space of Morris. If this is more than 1 centimeter, then anterior point of the anteroposterior diameter of outlet extends below the pubic symphysis on the rami for a distance of equivalent of waist space of Morris. So this distance between the said point and the tip of the sacrum is called anteroposterior diameter of outlet. I think you guys did not understand this. So I'll again draw a diagram. So if you see, this is waist space of Morris. Just a minute, I'll draw a diagram. So this is the diagram which I thought. So this is the waist space of Morris, as I have already said. So this is waist space of Morris. Okay. So anteroposteriorly in this diameter, we can also see this waist space of Morris. So if you see, in the anteroposterior diameter, so the first anteroposterior diameter of pelvic outlet. So anteroposterior diameter of the pelvic outlet, normally it is here. This is the anteroposterior diameter of pelvic outlet, normal pelvic outlet, that is normal pelvic outlet, and that too anteroposterior diameter of obstetric pelvic outlet. I'm talking about obstetric pelvic outlet, right? Okay, but this is normally what is it? Anteroposterior diameter of obstetric outlet. But if there is space of waist space of Morris, in such cases this diameter which is there, this will extend 1 centimeter below based on this change. So this change and this change should correspond with each other. So this is nothing but waist space of Morris again. Okay, so this is the new obstetric diameter, anteroposterior diameter, which you see. So this distance is equivalent to the waist space of Morris. So this distance which is there, this distance is called as available anteroposterior diameter of outlet. This is the extra diameter which is right now we got it because of this waist space of Morris. It is through this diameter that the head escapes out of the bony pelvis. Why is it important? It is important because it is through this diameter that the head of the baby escapes the pelvic outlet through this. So this is about the pelvic outlet. Thank you guys for watching my lecture. Thank you.